Hello everyone, welcome back to my channel. In today's topic, we will discuss the classification of adrenergic and antiadrenergic drugs. Adrenergic drugs are also known as sympathomimetic because they mimic the sympathetic nervous system. They act on adrenergic receptors, which are alpha and beta receptor. On the other hand, antiadrenergic drugs are blocking agents. Both type of drugs are widely used in cardiovascular, respiratory, CNS and other conditions like central nervous system disorders. Next, adrenergic drugs classification. Adrenergic drugs are classified into pressure agents, cardiac stimulants, bronchodilators, nasal decongestants, CNS stimulants, anoretics, uterine relaxants. Next, come to the point, pressure agents. These drugs increase blood pressure. Example include noradrenaline, which is also called norepinephrine, epinephrine, dopamine, phenylphrin, methoxamine, mephentermine. Next, come to the point, cardiac stimulants. These stimulate the heart and are used in cardiac emergencies. Example are adrenaline, isoprenaline, dobutamine. Next, bronchodilators. These drugs relax the bronchial muscles and are useful in asthma and COPD. Example are isoprenaline, salbutamol, terbutaline, salmeterol, formoterol, bambuterol. Next, come to the point, nasal decongestants. These provide relief in nasal congestion. Example are xylometazoline, oxymetazoline, nefazoline, phenylphrin, pseudoephedrine. Next, CNS stimulants. These stimulate the brain and are used in conditions such as ADHD and narcolepsy. Example include amphetamine, dexamphetamine, methamphetamine, methylphenidate. Next, anoretics. These drugs suppress appetite. Example are amphetamine, fenfluramine, sibutramine. Next, come to the point, uterine relaxants. These relax the uterus and are useful to prevent premature labor. Example are ritodrine, isox, suprin, salbutamol, terbutaline. Next, come to the point, antiadrenergic drugs. Antiadrenergic drugs are classified into alpha adrenergic blocking drugs and beta adrenergic blocking drugs. Then now let's move to antiadrenergic drugs. The first group is alpha adrenergic blocking drugs, which are classified into two main types: non-equilibrium, which is irreversible, and equilibrium, competitive antagonist. Non-equilibrium type. In the non-equilibrium type, the main example is beta haloalkylamine, phenoxybenzamine. Example. Equilibrium type, which is competitive antagonist. In the equilibrium type, we have non-selective blockers. Non-selective blockers, example ergot alkaloids, example drugs like ergotamine, etc. etc. Hydrogenated ergot alkaloids, example DHE. Next, imidazoline. Miscellaneous have uh, chlorpromazine. Okay. Then selective blockers. Selective blockers have alpha 1 selective and alpha 2 selective. Alpha 1 selective, example prazosin, terazosin, and etc. Alpha 2 selective, bin. Beta adrenergic blocking drugs classification. Next, we have beta adrenergic blocking drugs. They are further classified as non-selective, cardioselective, and generation-wise classification. Among the non-selective blockers without ISA, example propanolol, sotalol, timolol. With ISA, pindolol. With alpha blocking property, labetalol, carvedilol. Cardioselective, metoprolol, atenolol, acebutolol, bisoprolol, esmolol, betaxolol, celiprolol, nebivolol. Then generation wise classification. Based on generation, first generation, which is older and non-selective, example these are propanolol, timolol, sotalol, pindolol. Then second generation, beta 1 selective, metoprolol, atenolol, acebutolol, bisoprolol, esmolol. Then third generation, alpha blocking and vasodilator property have labetalol, carvedilol, etc. etc. Then adrenergic drugs stimulate alpha and beta receptors. It's a simple. And antiadrenergic drugs blocks these receptors. They are widely used in the treatment of hypertension, asthma, heart failure, CNS disorder. Thank you for watching.